So now we learn regarding the disorders of the pituitary gland. So these are the various disorders. So commonly the person will be suffering from due to hyposecretion or hypersecretions of the hormones. So that was secreted from the pituitary gland. The first one is the gignatisms. Okay, so it is observed in the children that the excess due to the excess of the secretions of the growth hormones. So it is denoted by the height should be grow more than the 7 to 8 feet or 2.1 to 2.4 meter. Okay, if the height is grow more than 7 to 7, that is 8 feet means, so that indicates, so that candidate was suffering from the gignatisms. And gignatism is the one of the metabolic disorder. So that was occurs due to over secretions of the growth hormones. So these growth hormones, so mainly they can stimulate the epiphyseal cartilage. So these epiphyseal cartilage, so they are present in the head of the long bones, and their major so they are absorb the calcium and minerals from the blood and involved in the overall development of the bones. Okay, so that if it is excess of the growth hormone means the height should be the more than 7 to 8 feet. Okay, so regarding symptoms, the person was suffering from the hyperglycemia, constant headache, and as well as the usual disturbance. Then another condition that was known as the acromegaly. So it is also causes due to hypersecretions of the growth hormones. And regarding the sign and symptom, they are similar or condition. They are similar to the gignatism. But the growth hormone secretion was increases after the bone ossifications. Okay, so regarding the symptoms, that is the face becomes the puffy face, then as well as blogging of eye, broadening nose and bones, and as well as the person who was suffering from diabetes mellitus, hypertension, and consistent headaches. So these are the sign and symptoms of the acromegaly. Okay, so next one is the pituitary diaphysium. So this is caused due to deficiency of the growth hormones. So the growth hormones, so that will be secreted in the less quantity as compared to normal. So already you know. So daily in the infant, that should be the 400 to 500 nanogram. That is the output of the growth hormone. If it is less than that, then the growth of that fetus or that baby or infant, that was decreases. So that was the responsible for to cause of the metabolic disorder. So that was known as the pituitary dwarfism. So in the pituitary dwarfisms, the height is less than 3 feet. Okay, if the height of the person is less than 3 feet means, so that condition is known as the pituitary dwarfisms. It is occurred due to the deficiency of the growth hormones or any other hormones also. It can reflect on the growth of the body. And as for example, that is a lack of FSH and lack of LH, then testosterone, estrogen, progesterone is not synthesized. Okay, estrogen, progesterone, testosterone. So these are also required for the protein synthesis, and proteins is required for the development of the body. So that's why the secretions of the FSS and LSS, even thyroid stimulating hormone, the person is suffering from the lack of the growth. So that condition is known as the pituitary dwarfisms. Okay, so then next one is the diabetes insipidus. There is a uncontrol in the urine output. So that condition is known as the diabetes insipidus. So diabetes insipidus is occurs due to hyposecretions of the antidiuretic hormones from the posterior pituitary gland. So lack of or malfunctions of the posterior pituitary gland. So there is no ADH was secreted. So due to lack of ADH, the urine output is increases because the antidiuretic hormones, it was mainly acts on the renal tubules where, so that can enhance the reabsorptions of the water. And lack of ADH, so there is no reabsorption of water is taken place from the kidney or from the nephron. So due to that reason, the urine output is increases, so that was responsible for to cause of the severe hydration, dehydration also. And that condition where there is no control on the urine output, so that was known as the diabetes insipidus. So next one, so regarding the ischemic necrosis, that is the deficiency of the oxygen. Okay, deficiency of the oxygen in the tissues. So that was responsible for to cause of the necrosis, and that is the cell death simply or tissue death. So that was known as the ischemic necrosis. So ischemic necrosis is also causes due to deficiency of the entire pituitary or various hormones from the pituitary gland. So because especially the ACTH, it was involved in the regulations of the cardiac output through a adrenal cortex. That ACTH acts on the adrenal cortex. So for the adrenal cortex, the adrenaline, noradrenaline, or from the adrenal medulla, adrenaline, noradrenaline was releases, and also glucocorticoids, mineralocorticoids, they are releases, and many other hormones. So they are involved in the to maintain the cardiac output, to maintain the rate of respirations. And failure of those hormones or hyposecretions of those hormones, then demand of the cell or demand of the tissue is not fulfilled, and that condition is known as the ischemic necrosis. So next one is the Forley syndrome. It is the condition caused due to hypopituitarism characterized by the decrease in the all pituitary hormones, especially deficiency of growth hormone, follicle stimulating hormone, and as well as the luteinizing hormone. So due to that, the person was suffering from the reduced growth, delayed sexual development, obesity in the females. Some individual might be develop the learning disability, lack of the cognitive functions or memory. So that condition is occurs due to hyposecretion of the growth hormone, FSH and LH, and that syndrome or condition is known as the Forley syndromes. So next one is the pituitary adenoma. Adenoma, the word it can end with the oma. Oma indicates that is the cancer. That is abnormal growth of the cell. It was responsible for the formations of the tumor, and that condition is occurs in the pituitary gland means. So that condition is known as the pituitary adenoma. So the pituitary adenoma, it is one of the most common disease associated with the pituitary gland in the is a pituitary adenoma. Okay, in this condition, the tumor is absorbed in the cellular regions of the gland. Okay, any tumors or abnormal growth of cells in the pituitary glands near the cellular region. So that is indications of the pituitary adenoma, because the cellular regions it is the just below the hypothalamus, and that is the locations of the pituitary gland. If it is swell, if it is any tumors is occurs in the cellular region, okay, from the brain images, so that can denote that candidate was suffering from the pituitary adenoma. So next one, that is the disorder related to the thyroid gland. That is the first one is the cretinism. It is occur due to deficiency of the thyroxine in children. So that is the symptoms like pot belly, pigeon chest in children with physical and mental retardedness, or even that child is suffering from the idiotics, because the thyroxine, okay, that is the T4 especially, it was only cross the blood brain barrier. Then what it can control to T3, then that T3 is involved in the development of the brain. So due to deficiency of the thyroxine or T4, that children was suffering from the mental retardedness or idiotics, and even dwarfisms. Okay, that is the decrease the growth or height. So that condition is known as the cretinism. It is occurred due to hypothyroidisms or deficiency of the thyroxines in the children. So next one is the max edema. That is the deficiency of the thyroxines in the adults. Due to that adult is suffering from the puffiness of skin, mental retardedness, low body temperature, low BMR, then also there is a fluctuations in the blood pressure. So that condition in the adult due to occur due to deficiency of that is thyroid hormones that was known as the max edema. So next one is the simple goiter, that is swelling of the thyroid gland that was easily visible when you are visiting the your neck. So that is occur due to deficiency of the iodine in the diet. Then it can cause the deficiency of the thyroxines. It was denoted just putting your hand on the thyroid gland. If daily you can observe, so now it is normal. If you are suffering from the deficiency of iodine or malfunctions of thyroid gland, means on that time the thyroid glands was swell. That is indicates we are suffering from the simple goiter. And also the metabolic rate was decreases, the blood pressure is also decreases, the heart rate is also decreases, even the person is suffering with fatigue and as well as the sluggishness. So next one is the, that is the ex-ophthalmic goiters are also known as the Graves disease. So this disease is occurs due to overstimulations of the thyroid glands or simple the oversecretion or hypersecretions of the T3 T4. The person is suffering from the one abnormal or metabolic disorder. So that was known as the Graves disease or ex-ophthalmic goiter. The symptoms are, that is the goiter, then plugging of eyeball. The eyeball is that is the outside of the your look like a outside of your eye, that was known as the plugging of eyeball, or increased BMR, increased blood pressure, increased heart rate, even restlessness or nervousness. That was indications of the over secretions of T3 and T4. So next one we can discuss regarding the disorders of the parathyroid gland. So these are the locations of parathyroid gland. So they are present on the thyroid glands. They are the 4 in number. So these parathyroid glands mainly secrete the PTH. Okay. So disorder related to the parathyroid glands are parathyroid tetany. It is occurs due to deficiency of the parathyroid hormone. So already you know the PTH, it was involved in the regulations of the calcium. So in our body, it is mainly when the plasma concentration of calcium is decreases. So on that time only the PTH is releases. It is mainly acts on the bone. It can stimulate the osteoclasts and it acts on the JT, enhance the absorptions of the calcium, acts on the kidney, inhibit the excretions. And deficiency of the parathyroid hormones, the muscles pause, and also the sustained contractions of muscle is present, then also it may cause the death. So that condition is known as the parathyroid tetany, that was occurred due to deficiency of the calcium. So next one is the osteoporosis, that is the over secretions of parathyroid hormones. The density of the bone that was decreases due to release of the more phosphate, more calcium, more minerals from the bone due to over secretions of PTH and parathyroid hormone. So that condition is known as the osteoporosis. That is the, it can cause the decalcifications of bones, and also bones become the soft and porous, lack of the minerals. So it can easily, you can see in the this image, this is the normal bone, so this is the osteoporic bone. So there is a cavity is forms, pores is formed due to lack of the material or matrix in the bone. So that condition is known as the osteoporosis. So next one, so the disorder related to the adrenal gland. So already you know the adrenal gland. So they are present in the cap of the kidney. So these adrenal glands is mainly divided into two parts, the adrenal cortex and adrenal medulla. So adrenal medulla, it was mainly involved in secretions of adrenaline and noradrenaline. So those adrenaline noradrenaline is involved in the regulations of blood pressure. And cortex, it can secrete the mineralocorticoids involved in the mineral regulations. It can secrete the glucocorticoids that was involved in the regulations of the glucose or management of the stress. And next one, it can secrete the androgens. So those are involved in the to regulations of the secondary sexual characters, or it can supports the that is the testosterone, estrogen, and as well as the progesterone's activity. Okay, so regarding disorder related to the adrenal gland, that is the first one is the addition disease. Okay, that was also known as the Addison's disease. Okay, so it is causes due to hypofunctioning of the adrenal cortex. So this is the Addison disease. So that is occurs due to hypofunctioning of the adrenal cortex. So where the bronze color skin pigmentation is occurs, and as well as there is a low sodium, low and high potassium level in the blood, because the adrenal cortex it mainly secretes the mineralocorticoids, and mineralocorticoid it mainly regulate the electrolytes like sodium. It can enhance the reabsorption of sodium and causes the excretions of the potassium. But due to lack of the adrenal cortex function, the sodium cannot be reabsorbed. So due to that, the loss of sodium is more present. So that was responsible to cause the low sodium level and high potassium level in the blood in the case of the hypofunctioning of the adrenal cortex or Addison disease. Also decrease the resistance to the infections. Okay, due to lack of glucocorticoids, the resistance towards the infection is decreased, because the glucocorticoids they are the strong anti-inflammatory agent and as well as anti-allergic agent. So they are fight against the infections, and lack of those hormones, so there is a resistance can be decreases easily. The infections in our body can be occurs. The next one is the Cushing syndrome. It is occurred due to hyperfunctioning of the adrenal cortex or more secretions of the glucocorticoids and as well as the mineralocorticoids. So that is the symptoms: abnormal obesity, high sodium, low potassium level in blood will be the found. Then another one is the aldosteronism, the more secretions of aldosterone. So that condition is known as aldosteronism. Symptoms: that is the high sodium level and low potassium level in blood, and also the high blood pressure is increases and blood volume is also increases. Then one is another is the adrenal virilisms. Okay, so it is mainly occurs in the female due to more secretions of the androgens. So due to this reason, the female is suffering from the development of the male characters like a beard and mustache, and voice is also increases. That is the loudness is increases. So that is the similar to the male. So due to more secretions of androgen from the adrenal cortex, and that condition in the female is known as the adrenal virilisms. So next one, the disorders that was related to the pancreatic gland, that is the diabetes mellitus. That is the condition caused due to destructions or dysfunctions of the beta cells, the where the beta cells are failed to release the insulin. So that condition is known as the diabetes mellitus. And the diabetes mellitus are two types: type 1, type 2. In type 1, the pancreas failed to produce the insulin. That is known as the type 1 diabetes mellitus. So the treatment is insulin injection itself. And type 2, insulin is secreted, but due to genetic mutations or mutations of the insulin receptors, so insulin was failed to bind on the insulin receptors, and that condition is known as the type 2 diabetes mellitus. Nothing but the blood sugar level is more than the normal, so that condition is known as the diabetes mellitus. And other conditions, that is the hyperglycemia, abnormal high blood glucose level is known as the hyperglycemia, and abnormally low blood glucose level, so that was known as the hypoglycemia. So these are the three metabolic disorders, so they are associated with the malfunctions of the pancreatic glands.